Hey guys, Lori here, pharmacist. Earlier in the week, I had a couple of people ask me to do a video on the pneumonia vaccine. And it's funny because I've tried 2 times to make this video, and for whatever reason, I just couldn't get it out the door. But when I started diving back into it today to get together what I wanted to present, I realized why I feel like the Lord didn't let me move forward, because I came across something huge that I hadn't seen when I was attempting to make the other videos, and I think it's just, I'm just so glad I saw this and it didn't get by me. But anyway, as far as the pneumonia vaccine in infants and adults, I'm going to start out with adults. You know, I work in the area of medication therapy management, which means I'm on the phone doing patient consults for patients all over the U.S. And the majority of our patients are, 60 to 90 range. I mean, we'll get the occasional one that's in their 40s or whatever, and they have disease states that include high blood pressure, diabetes, heart failure, COPD or asthma. Those are pretty much the 5 disease states. You have to have one of the 5 in order to qualify for our services, basically. And we contract with insurance companies. But last year, when I started this job, which was in November, I was so struck by the number of people, and I did not keep track of it because it didn't occur to me to at that point, but the number of elderly people that had had the pneumonia shot, the flu shot, and yet still ended up in the hospital with the flu and pneumonia. This year I'm keeping track of it. This year I'm keeping tally. And it just kind of became a saying with me as I would be talking to them and they'd tell me that they had both the shots. I said, well, that worked out well, didn't it? They say the pneumonia shot for adults is 60 to 70% effective. Considering the percentage of America that I talk to alone, which, I might do as many as 30 phone calls a day. Usually it's more like in the range of, it's 15 to 25. But for me to have 10, 15 people, it was somewhere in that range, tell me that, I just don't think off the cuff that is coming up with a 60 or 70% effectiveness. But like I said, I wish we had this on the radar for all of our pharmacists to be doing, but I'm odd man out as usual. Anyway, so I'm just going to talk about first what's in the vaccines, and then I'm going to talk about the vaccines in infants. So there's 2 types of pneumonia vaccines on the market. There's Prevnar 13, which covers 13 strains. That's the one they're given to your tiny babies at 2, 4, and 6 months. And then there's Pneumovax 23, which covers 23 strains. That's for children 2 years and up, and it's most often dosed in adults over 65, or that's the recommended. Actually, they do the Pneumovax and they're supposed to wait another year and get the Prevnar, or vice versa, adults over 65. The Pneumovax has an interesting ingredient. It's called phenol. If you do any research on phenol, it is a disinfectant. It is extremely corrosive. The little syringe that you're going to get injected into your arm is going to have saline with a 0.25% of phenol in it. I know years ago when I was vaccinating, sadly, patients, one lady I had given it to had a very severe injection reaction. Of course, at that point, I had no idea I'd injected phenol into her, but kind of explains things now. Anyway, it took her and I should have filed a VAERS, but I didn't know about that either. They didn't really teach us much about VAERS. So anyway, you got your phenol, and then in that trial that they did with the Pneumovax, the saline placebo that they used had phenol in it too. In the Prevnar 13, sorry, I got dogs in here, you've got polysorbate 80. It actually contains the diphtheria toxin also, and it's got 125 micrograms of aluminum. In the Pneumovax study, there were a lot of serious adverse events. Again, what are adverse events? That means you went to the hospital. It means you almost died. It was life-threatening. It required hospitalization, and sometimes resulted in a disability. You never fully recover. Anyway, 10 people in the Pneumovax study had severe adverse reactions within 14 days of vaccination. 6 of those had received the Pneumovax and 4 had received the placebo. So I think the phenol might not be a great idea. They had angina pectoris, which is chest pain, heart failure, chest pain, again, ulcerative colitis, depression, headache, tremors, stiffness, sweating. And then in 14 days after the placebo, they had a myocardial infarction, which is a heart attack, complicated with heart failure, chest pain, edema, urinary retention, heart failure, and diabetes. 5 subjects were outside the 14-day follow-up who received the Pneumovax, and 5 people died. I'm sorry. Outside of the 14-day range, 5 people died. This is all adults that were over 65. Heart attack, stroke, heart failure. One had a motor vehicle accident, it says, but whatever. So, again, according to the literature, CDC, 60 to 70%. I don't know. I think I'll skip the phenol injection, but that's just me. So then we got Prevnar 13. Now, they did studies actually in infants and in adults on this one. So, let's see. In the adult studies, 70% or 70 subjects had serious adverse events. That was out of 5,000. Then in the placebo, and then in the Prevnar study, they actually used either a placebo, which had to be the aluminum again, was in the placebo, judging from the adverse reaction at the injection site, or they used Pneumovax. And there were 16 deaths in that study, and that's in adults. Serious adverse events, there were 327 in the Prevnar 13, 314 in the placebo. And the years follow-up to 4 years after vaccination, there were 3,006 deaths in the Prevnar group, 3,005 deaths in the placebo group. Of course, you know, they want to make this look like these people were just old and their lives just sucked. I mean, in my opinion, because they tell you placebo, and any pharmacist or even doctor reading this and that doesn't read the fine print, that doesn't realize how the clinical trials with vaccinations work, is going to think a placebo was a saline solution. So they're going to say, you know, the odds are these people were just old, and, you know. But when you know the truth about what's really in the placebo, and that it's got the aluminum and the polysorbate 80 and the diphtheria that is part of the adjuvant, you realize that this would be a great way to off Granny, perhaps. You know, or a great way to off Grandpa. It's what it looks like to me. I mean, 3,000. So over 6,000 people died within 4 years of this that may have never even gotten pneumonia. Because the thing about pneumonia is that pneumonia is a secondary. Okay, pneumonia jumps on people most often that are already sick with something. They're already immunocompromised in some form or fashion. So, then you go inject them with this, and you can help move everything right along. Let's see. Do I want to say anything else about Prevnar 13? Not as far as adults, but when it came to children, They didn't really report that many deaths. But what got interesting, and this is what I was not prepared for but blew my mind. So, like I said, the two vaccines that are available today are the Prevnar 13 and the Pneumovax. Well, prior to Prevnar 13, there was a Prevnar 7. And the interesting thing about the Prevnar 13 trials is that they used Prevnar 7 as their placebo. The Prevnar 7 was done on infants, infants and up to 17 years of age was the age range. But the majority of the test subjects were infants and toddlers. And the reason for that was they were looking to get this on the immunization schedule for children, which they do. Now, I'm going to tell you something about pneumonia, and that is when my kids were growing up, or when they were infants, and all growing up, they never had pneumonia, but pneumonia was not even on my radar. And I was looking through some stuff yesterday, and I want to tell you what the incidence, deaths from pneumonia, this is according to the New England Journal of Medicine, this is in the U.S. In 1995, matter of fact, as of about 1983, we were approaching 1 to 2% in 100,000 children were dying of pneumonia. Why did we need a vaccine on the schedule? Why? To me, this is almost as stupid as Hep B. Injecting infants to prevent pneumonia, especially in light. The Prevnar 7 has the same aluminum. It's got the exact same makeup, except it only covered 7 strains instead of the now 13. But anyway, as I'm looking at this, I found the Prevnar 7, and I wasn't going to talk about that. And then I happened to stumble on that today, and I printed it out, and I'm looking at it, and this was there were several studies done, by the way. And in some of the studies, I mean, just how they went about it was different depending, but the one study where they report the SIDS deaths was in the one where they did the U.S. vaccine schedule minus the Prevnar or the schedule with the Prevnar. There were 33 deaths from SIDS in the study. 33 out of, I mean, who cares? Who cares? What's the number? What's the number that's big enough to justify 33 deaths in a clinical study? And there was only one out of all the studies that they did that they even reported SIDS in the package insert. So how could they do this study and not know? Because actually 12 deaths, it says, occurred in the ones that received the Prevnar, and this was the Kaiser efficacy study. One was a child that was an older child, it says. And then 21 deaths, in comparison, 21 deaths and one SIDS-like death occurred in the control vaccine group during the same time period. The control group, from what I understand, did not receive the Prevnar 7, but they received all the other vaccines that are on the schedule, except it doesn't list rotavirus. So thank God they gave him a break. Maybe there'd have been more deaths. But how many children have to be sacrificed? And why? Why are we vaccinating tiny babies when in 1995 we didn't start vaccinating? I don't think it hit the schedule until 2000, the Prevnar 7. In 1995, we were almost at 0% deaths. I mean, not even zero, just the number 0 deaths. We were at 1 in 100,000. What kind of insanity is this? You guys, this has to stop. It's got to stop. And I pray every day. I mean, you don't even know. This is a battle. This is a battle for our children. This is insanity. It is complete insanity. I've got some other videos I'm going to do coming up, but I'm going to leave this one here. I'm going to talk, one of the videos I'm going to do is going to talk about why we have to keep re-injecting the tiny babies. But anyway, I love you guys. Keep praying. Do whatever you can to spread the word. All right, love you. We'll talk soon.